Thank you for joining us today for the program on the Governance Request for Information. This is Kate Berry, CEO of National eHealth Collaborative, and we're very pleased to host this webinar and to cover this really important topic. And next slide, please. As always, the slides are available at the URL that's going to be up on the screen here in a moment, so you can access the slides right at that URL. And in addition, after the presentation, we will open it up for Q&A, and you can enter your questions in the right-hand side of your screen. So without further introduction, I do want to introduce Stephen Posnack, who's going to walk us through the Governance Request for Information. Stephen is Director of the Federal Policy Division within ONC. He joined ONC in 2005 and has served as Project Officer of the Health Information Security and Privacy Collaboration and as the lead staff for the American Health Information Community Confidentiality, Privacy, and Security Work Group. He's currently responsible for ONC's legislative and regulatory affairs, and in this capacity has heads up the ONC's review of legislation and regulations from across the executive branch, briefing ONC leadership on legislative and regulatory issues that affect ONC. And in response to the HITECH Act, his responsibilities were also expanded to oversee ONC regulation development efforts. So again, I'd like to turn the program over to Stephen.
All right, thank you very much, Kate. So thank you to everyone out there for attending today. This is a momentous time in health policy overall, and even more so in health IT policy. The HITECH Act, meaningful use, health reform, a number of other activities going on right now have all had an immeasurable effect on the HIT landscape. I'm here today to walk you through the brand new Request for Information, RFI, from ONC entitled Nationwide Health Information Network Conditions for Trusted Exchange. For the next hour, I'm going to be taking you on a journey, so buckle up. We have got a lot to cover. I'm not going to do any justice to the Request for Information. It has been submitted to the Federal Register. Will go on display at some point in the very near future, so it's a little bit out of our hands at this point. You'll see a listserv announcement from us. You'll see other information, and I'm sure folks will tweet about it, will blog about it, etc. as soon as it's available. So unless you're going off the grid anytime soon, you will probably know just as soon as we do when it's available, just to get that out of the way quickly. The RFI is jam-packed with information. So before we jump into the details, I just want to ground folks with a few overarching points. It's time for governance, and ONC intends to lead that conversation, and I think a conversation that we're all ready to have across the stakeholder community. Another point that I just want to ground folks in, kind of expecting a question, why did we publish an RFI instead of just going straight to a notice of proposed rulemaking? We've done this because as much as everyone has contributed, this is just the beginning, and that's a point that you'll hear me echo from time to time throughout my presentation here. And that's a little dose of humility that I'd like everyone to really keep in mind as we go across the presentation today and through this journey. We recognize here that governance is a lot bigger than just ONC, and that's why we're coming to you. That's why we're publishing this RFI. We believe in open, inclusive, and transparent processes and need everyone's feedback and expertise because we don't know all the answers, and in order for us to do our part, we need you to do your part. That's why I'm here today. This is the RFI. This RFI is ONC saying, now it's your turn to contribute. So consider what we're missing, what we can make better, and whether we'll get to the outcomes that we seek to achieve in the draft that will be included and comprise the RFI. Process-wise, we'll take your feedback on the RFI. We'll use it to refine NPRM proposals that we're working on and currently drafting. And it's all part of this process, but this is really a unique opportunity for us to provide the industry and stakeholders at large an opportunity to give us some immediate feedback on some of the things that we're considering, some of the challenges that we're grappling with, and really help us work together in a partnership going forward with respect to governance. Next slide, please. All right. So for those of you that know me or have caught my presentations before, I always try to start from the top, which in this case means starting with statutory authority. So the Public Health Service Act, which is amended to include, as a result of the HITECH Act, a number of new responsibilities for ONC, in addition to the State Health Information Exchange Cooperative Agreement Program, the REC program, meaningful use, etc. There is a provision that requires the national coordinator to, quote unquote, establish a governance mechanism for the Nationwide Health Information Network. And we are doing what we can to best work with that sentence that we've got in the statute and to implement it in an effective way to really make a difference in the health information exchange ecosystem and environment. So I'd note here that the statute didn't say the national coordinator shall govern the Nationwide Health Information Network. Rather, it charges us to establish a mechanism for governance. As the RFI explains in greater detail, we have approached implementing this statutory language by asking, where can ONC uniquely add value? And in answering this question, we framed a multifaceted approach in terms of what we think an effective governance mechanism should be. And so another area that I'd like to anchor folks in terms of the mental model as you take in all of this information today and as you read through the RFI to really ground yourself. We're looking to create, and what you'll see in the RFI, we're looking to create the fundamental structures and processes that are necessary to make governance work for the long term. And so at its core, the governance mechanism that we're discussing to establish is not about one particular form or method of exchange. It's not about a particular set of standards. It's not about a particular set of policies. It's really more about what needs to be in place in order for the industry to evolve, for the marketplace to mature, and for many different forms of electronic health information to take place in a trusted and secure manner. And I'd really like the folks to keep that element in mind as we go forward, and as again, we're starting from the beginning here, creating this comprehensive set of structures and processes to really create a good foundation upon which we can build to allow a real extensible approach for governance of the Nationwide Health Information Network going forward. Next slide, please. So what is the Nationwide Health Information Network? I'll probably be using the NeHC pronunciation of the abbreviation or acronym. So I can tell you a couple things. It's not. The NeHC is not a single national database. So we get that question from time to time. I'm here to tell you that it's not. It is also not a network of networks. That was prior lingo that we used to describe the state of affairs at the time that the industry was maturing. But today, as we describe the Nationwide Health Information Network, it is and every ONC person needs to know this off the tip of their tongue, it is a set of standards, services, and policies that enable secure health information exchange over the Internet. And like the Internet, when the right set of standards, services, and policies are put in place, great things can happen. And that is really our vision for the governance mechanism that we hope to establish, to create, in essence, a big bang moment for electronic health information exchange. Next slide, please. So you may have noticed that there's not a specific statutory deadline next to our authority, which is both a blessing and a curse. But as I mentioned, we're really at the beginning of this process for the nation to wrap its head around what governance of the Nationwide Health Information Network would look like. A number of you have been involved in these conversations with me in other venues over the course of many years, and now is really the time where a lot of the issues that we've discussed thus far have really ripened to a point where we're putting them together in a suite. It really has a lot of potential now at this point. So among many other reasons than these 4 bullets listed on the slide, we believe that the time is now to act to establish a governance mechanism for the Nationwide Health Information Network. Electronic health information exchange addresses a critical need in our healthcare system. It's going to be the foundation on which improved care coordination and quality improvement goes forward. One of the things that we've been talking about here at ONC with respect to electronic health information exchange is that its speed is kind of rate limited by the speed of trust. And in order for us to increase and really accelerate electronic health information exchange, we need to correspondingly increase the speed of trust that is currently out there in the ecosystem. So the second bullet is really important, and part of what we hope to achieve with our proposed governance mechanism is to shift the trust paradigm that exists today, which is really trust on a first-name basis. Today, providers who electronically exchange information typically know each other, and in most cases, know each other on a first-name basis. And that's really where trust comes in, and when you can't see that other person, that's something that anchors folks and that folks hold on to. What we need and what we're looking forward to is an electronic health information exchange environment that can enable trusted exchange to occur beyond those providers with whom you're on a first-name basis to any provider from which a patient may seek care. And part of what we put forward for the governance mechanism is about making that shift together. With respect to this third bullet, I think it really just sums it up, kind of a nutshell point. Electronic exchange has enormous potential. But in order to unlock that potential, we need some baseline rules of the road. And that's what this governance mechanism and the detail in the RFI are all about. Finally, this last bullet reflects essentially a fact of life. In the absence of action on ONC's part to implement this statutory authority to establish a governance mechanism, stakeholders could have unmet needs with respect to the policies and standards, et cetera, that would govern in their local jurisdictions. And we intend to try to address those needs and create a governance mechanism, as I said, that can evolve over time. Next slide, please. So what are our overall objectives for the governance mechanism? The first being we view the establishment of a governance mechanism as a unique opportunity to create new markets and opportunities for innovation. And so if we can establish a mechanism upon which electronic health information exchange can grow, we see this as a new area where the markets can really take off. The second, as I mentioned previously, governance for us is about establishing an infrastructure that can support the steps that states and other stakeholders want to implement while setting forth some consistent minimum rules of the road that lets stakeholders focus on what matter overall, which is delivering high-quality care. And so if we can, at the federal level with your support and partnerships, coordinate a set of rules of the road, then we can hopefully create a more efficient environment overall for everyone engaged. The third area, as you may have noticed in the recent proposed rule from CMS on Meaningful Use Stage 2, there is some mention of governance with respect to the transitions of care, objective, and measure. And we really see the governance mechanism and the objectives that we hope to achieve with governance to lay a foundation that will be necessary to support future stages of meaningful use. And finally, we hope to use the governance mechanism as a way to galvanize stakeholders' focus on priorities towards an ever-maturing electronic health information exchange market. Next slide, please. So this is the bird's eye view of the RFI. Kind of followed it in chronological order in terms of how things are presented. Again, not going to be able to do it too much justice in the time that we have. So as a first anchor point here again for you on the RFI and the policies included therein primarily focus attention on the entities who facilitate electronic health information exchange. In general, the draft policies discussed in the RFI are not aimed at requirements that healthcare providers would need to meet, unless those healthcare providers are organizations and are seeking to facilitate electronic health information exchange for others. So it's really important to keep that point in mind that we're talking about entities who facilitate electronic health information exchange in this first foray into our governance approach and the structures and processes that we seek to establish. As the RFI states, as you read through it, we are not considering proposing some type of mandatory governance paradigm. Rather, we would like to construct the governance mechanism in such a way that its value to all stakeholders in the market is what drives compliance with the conditions for trusted exchange that we'd establish. So the RFI seeks comment on 5 areas, but they really boil down to 3 concepts. The first concept being, what consistent rules of the road should entities that facilitate electronic health information exchange follow? Those are expressed in what we call conditions for trusted exchange. And there's a subsequent component regarding monitor and oversight with respect to the conditions for trusted exchange as well. The second concept has to do with the process that should be in place to validate entities that meet and how they meet, or if they meet, the conditions for trusted exchange. We include a discussion about what we're calling validation, which we believe could encompass many different aspects of analysis, ranging from certification to accreditation and a variety of other processes that could be in place. So that's an area where feedback is definitely welcome because we're talking about entities and not products or a certain type of software. It's a little bit of a different paradigm and a little bit of a different regulatory approach than we have taken thus far with Health IT certification. There are a lot of similarities in the processes that we've suggested, but there are some differences that we've acknowledged in the RFI and for which we seek comment on. The third, finally, being when we look at this multifaceted approach to establishing the governance mechanism, an element of that we believe is important is answering the question of what can we put in place to create a clear, predictable pathway for standards and implementation specifications to reach the national stage and to be acknowledged as mature, adoptable, ready for inclusion in regulation if that is the endpoint for some of them, or in other cases just ready for national use. And that is one of the things that you'll see discussed in the RFI in terms of our proposal for really the structure and process for how we would classify the readiness, or working with you all, establish a process to classify the readiness of technical standards and implementation specifications, as well as similarly a process to update and retire the conditions for trusted exchange, because we expect and anticipate that those will need to change over time as the industry matures. Next slide, please. So we have we've categorized the CTEs, and I'll use CTEs as the acronym here for conditions of trusted exchange, conditions for trusted exchange. We've categorized the CTEs into 3 buckets. Safeguard CTEs, so these focus on the protection of individually identifiable health information to ensure its confidentiality, integrity, and availability, and to prevent unauthorized or inappropriate access, use, or disclosure. Interoperability CTEs to focus on the technical standards and implementation specifications needed for exchanging electronic health information. And finally, the third category, business practices, CTEs, which would focus on the operational financial practices to which NVEs would need to adhere in order to, in support of trusted electronic health information exchange. Again, keeping in mind, the CTEs are designed and framed in a way that they will apply to entities that facilitate electronic health information exchange. So if you're multitasking while you're attending this webinar, this is where I need to do a public service announcement to ask you to give me your undivided attention. I'm going to go through some of the CTEs in detail next, but one thing that I do want to call out up front is that there are 16 CTEs that are listed through the slide deck. These are not exhaustive. It's not the ceiling. It's not the end of the list. Again, it's really the beginning. These are the first best draft set that we have available to share for pre-NPRM feedback, which is, again, you're right at the beginning of the process for us to help inform what we're working on in parallel, and to cover the areas that we believe there have been a decent amount of policy discussion in the community at large over the past few years, as well as in the HHE Standards Committee and the HHE Policy Committee. I don't think a meeting has gone by where I haven't heard the word governance mentioned. So if I had a nickel for every time governance is mentioned, I'd probably be a rich guy by now. I also want to emphasize that if you don't see an issue addressed in a condition for trusted exchange that's in the RFI, I wouldn't read anything into it. Let us know what that issue is. This is your opportunity to do so to help inform our NPRM processes. If there isn't a CTE that your issue fits into that we've included in the RFI, how a new CTE could address your issue, and ultimately, and most importantly, why it's important that that issue be addressed up front as part of this initial rulemaking. So again, this is exactly why we are seeking your input at this stage. I'd also note right now, this is just a list of the conditions for trusted exchange that we are considering, including in a notice of proposed rulemaking. We ask questions in the RFI, especially I think we have one kind of poignant focus question on how the CTEs could be packaged together for validation and which CTEs could be included in such packages. So it's we're not necessarily looking at it like there would be a sweet and all-or-nothing approach to validation to some of these CTEs. Rather, it may be the case that there could be certain packages established relative to a collection of CTEs that an NVE, a Nationwide Health Information Network Validated Entity, would be able to meet for particular services that it would be able to provide. And so I just reminded myself that I did not do a good job teasing out all of the acronyms that were on the prior slide. So again, with respect to entities that facilitate electronic health information exchange, those that are focused on by the RFI and the CTEs, we have another acronym for you to remember, and that would be NVE. N as in Nancy, V as in Victor, E as in exchange. NVE stands for, as the prior slide noted, Nationwide Health Information Network Validated Entity, and that's really the recognition that we discussed in the RFI that we believe could be attributed to entities that have met the CTEs that we established, and once going through the validation process, that they would be designated an NVE, and that would make it easier for them to be identified in the marketplace. Next slide, please. Okay, so here we get into the nuts and bolts. I'm going to voice over a few of these conditions for trusted exchange. As I mentioned before, there are 10 safeguards CTEs that are in the RFI. There are 3 interoperability CTEs in the RFI and 3 business practices CTEs in the RFI. So we've devoted quite a bit of attention to the safeguard CTEs. Again, keeping in mind our issues traveling, making sure that the environment and getting folks engaged in electronic health information exchange will only travel at the speed of trust. So the first one that I'll call out is the first one listed there on the table, and that's S1. So we've tried to give some logical order for people to keep track of the conditions for trusted exchange. The first condition that we've included has to do with really a fundamental baseline issue. And as we talk about the entities that facilitate electronic health information exchange, what security practices they would need to follow. And so CTE S1 is an example, and really one that we believe is important to the overall governance mechanism and framework for the CTEs that we've included. So to give you a little bit of background on it, the HIPAA security rule is the preeminent framework for securing electronic health information. Published in 2003, the HIPAA security rule sets forth a flexible and scalable approach to apply to a broad range of HIPAA-covered entities. So defined by statute, providers, plans, clearinghouses, including a variety of different healthcare providers I've got in my notes here I've just addressed. So in doing so, the HIPAA security will recognize that all of these different covered entities would have different needs and resources with respect to securing electronic health information in their environment. And in providing flexibility, the HIPAA security rule provides both required and addressable implementation specifications. As the rule is structured today, covered entities must meet the required implementation specifications, but are permitted to take equivalent alternative approaches to quote-unquote addressable implementation specifications if the covered entity has determined that such implementation specifications would not be reasonable or appropriate to the entity's particular environment. I'm sorry for all the kind of regulatory speak, but it's a very nuanced and particular issue that I don't want to get wrong ever. So another thing, kind of working forward chronologically, in 2009, with the enactment of the HITECH Act, Congress specified that the sections that we've noted in this CTE shall apply to business associates in the same manner as they apply to covered entities. Accordingly, and because we believe that, and we've kind of walked through many of these hypothetical scenarios, we believe that nearly all, if not all of them, of the NVEs will be business associates of covered entities, or in some cases covered entities themselves. We believe that mirroring the statutory requirement is the best starting point for NVE's overall security practices. One of our main goals in establishing a consistent trust baseline for electronic health information exchange is part of this governance mechanism. And we believe that in order to strengthen the public's trust of NVEs that we are seeking to create in this market, and NVEs' trust of each other, that all of the HIPAA security rules addressable implementation specifications should be required for all NVEs. We believe that this approach provides greater certainty and more uniformity with respect to the security practices that NVEs would need to follow. So again, creating a consistent baseline for these entities that would be facilitating electronic health information exchange. The next one I'll do a little bit of voiceover for you is S3. This one says an NVE must ensure that individuals are provided with a meaningful choice regarding whether their IHI may be exchanged by the NVE. For those of you that may have followed the Private Security Tiger Team, HIT Policy Committee, you know that this has been discussed at great length. We have, in many cases, I should do a short shout out to our advisory committee groups that have provided input that we've incorporated here. Across the HIT Policy Committee, we started over a year ago with the governance work group that was part of the HIT Policy Committee, and we really took a look across the board of all the recommendations that we received and how we could put them together into a document that could advance our discussion and conversation about governance. So S3 embodies some of the discussion that the HSE Policy Committee included with respect to privacy and security and meaningful choice. So in considering these recommendations from the HSE Policy Committee, we believe that individuals should be able to exercise meaningful choice with respect to how their electronic health information is exchanged. The HSE Policy Committee explained that meaningful choice could be either an opt-in or opt-out model or granular consent, so that so long as individuals or their legal designees are adequately and clearly informed about how and why their information will be exchanged in advance of making a decision whether to participate in exchange. In terms of providing meaningful choice, we believe that an NVE should be required to do the following to satisfy this CTE. Either directly provide the patient with meaningful choice regarding the exchange of their individual identifiable health information, or ensure with some means of verification that the healthcare provider for which it facilitates electronic health information exchange has provided individuals with meaningful choice regarding the exchange of their individually identifiable health information. Now, I'll also put here, this isn't a globally applicable policy. The RFI discusses in greater detail some of the other facets about this CTE. Mindful that the HSE Policy Committee's recommendations are premised on the belief that different means of exchange may invoke different privacy and security concerns. This one, NVE, and the way in which we see it relating today is in the context of the first interoperability CTE that I will get to in a second. We have included a discussion on what exceptions and to this provision for meaningful choice would be prudent, and other issues that we should consider in the CTE and for an entity to demonstrate compliance with the CTE in order to get validated. So I just wanted to make sure that everyone understands there's a lot more beneath the surface there with that CTE, but felt that folks probably gravitate towards that one pretty quickly on the slide deck, and thought I needed to give you some framing for it. S5 is another one where I'll actually stop here and do a quick reminder on one thing that I wanted to mention that I skipped over on my notes. We have tried to leverage everywhere possible existing regulatory frameworks and policies that exist today. So you'll notice with S1, we're not trying to rewrite the HIPAA security rule. We are trying to use what exists, apply it to the environment in which we think governance fits, again, where ONC is uniquely positioned, and leverage things that we can point to without duplicating effort and making it easier for entities that are subject to multiple regulatory requirements to find a clear path forward in this paradigm that we're trying to establish. So you'll see in some cases we have leveraged what we've got to work with already, making it applicable to the environment that we are looking at today, as well as areas where there may be some contrast in terms of filling a gap, and or where there are differences in electronic health information exchange that aren't necessarily addressed by a particular regulatory approach or other set of policies. So S5 is an example of one of those. Just to give you a little bit of context to ground you in this one, under the HIPAA privacy rule 45 CFR 164.520, individuals have the right to adequate notice of the uses and disclosures of their protected health information. So all this very HIPAA-centric, a right which a covered entity fulfills by furnishing a notice of privacy practices. Generally speaking, the HIPAA privacy rule notice of privacy practices must include a description of the types of uses and disclosures that the HIPAA-covered entity is permitted to make for treatment, payment, healthcare operations, as well as a description of other uses and disclosures which are permitted without the individual's written authorization. And so very centered and focused around uses and disclosures that the covered entity could make. The type of notice contemplated by this condition for trusted exchange would differ in certain aspects from a HIPAA privacy rule notice of privacy practices. First, rather than a notice directed only to consumers whose health information is being used or disclosed, we believe that NVEs should clearly give advance notice to those who use their services, as well as to the general public, why they collect individually identifiable health information, how it is used, and to whom and for what reason it is disclosed. Second, with the goal of increasing public trust and enabling electronic health information exchange, we believe that an NVE should give notice about what it actually does do with the information rather than what it is legally permitted to do with the individually identifiable information for which it is responsible for exchanging. Third and finally, we believe that an NVE should give explicit and specific notice about certain uses and disclosures of health information, such as the specific circumstances when it will de-identify health information and provide it to third parties. So that's just an example. Next slide, please. S6 is the last safeguard that I'll touch on. This states that an NVE must not use or disclose the identified health information to which it has access for any commercial purpose. As noted, some stakeholders have, as well as the HCT Policy Committee, expressed concern that certain persons may not be fully aware that someone transmitting data on their behalf may use the identified data for profit-seeking opportunities. This scenario appears to have raised two concerns in our community. The potential that certain recipients of the identified data possess their own established data banks and may be able to re-identify the data by comparing it to existing data, and providers losing trust in a system in which the data for which they are responsible, although de-identified, is monetized. And we recognize that under the HIPAA privacy rule, a provider could prohibit a business associate in its business associate agreement from de-identifying data and then subsequently using the de-identified data. However, we are aware of circumstances where certain business associates have drafted business associate agreements that allow for such de-identification of data for the business associate's purposes. Additionally, there are some market dynamics that we've been made aware of about smaller covered entities lacking the resources, legal expertise necessary to effectively negotiate business associate agreements. So overall, we drafted the CTE to seek comment on whether it would be appropriate to have a CTE essentially that prohibits NVEs from using or disclosing de-identified health information for economic gain, and whether that would alleviate the concerns that we've heard in the industry. Okay, next slide, please. All right, so here are three interoperability conditions for trusted exchange that we've included in the RFI. First one focusing on the ability to facilitate secure electronic health information exchange in two particular circumstances. The second related to establishing and discovering digital certificates, which is an important element in a number of circumstances, and recognizing that we feel is going to be a need going forward, both from a kind of long-term and structural and process standpoint. And then another subject that is has always been addressed, an NVE must have the ability to verify and match the subject of a message. So this is getting at matching. Again, we're seeking everyone's input here. What's right, where additional input needs to be made, where additional progress needs to be made before we would include something as a formal proposal in an NPRM. Again, just at the beginning here, so that's why it's really a unique opportunity to give us some immediate feedback on some of the issues that we've been considering. Next slide, please. Here are the three business practices, CTEs, that we have included in the RFI, and they focus on a variety of different areas that we've heard about in the community at large from a variety of stakeholders. Again, just to remind you of which each of these focus on, the business practice CTEs focus on the operational and financial practices to which NVEs would need to adhere in support of trusted electronic health information exchange. And so again, the governance mechanism focuses on entities that facilitate electronic health information exchange, and these CTEs focus on the behaviors and business practices of those entities. These CTEs are really about NVEs being trusted not only by the healthcare providers for whom they facilitate electronic health information exchange, but also the other NVEs that they may engage with. So essentially being, and I don't know if this is a good phrasing or not, but stand-up health information exchange citizenry and really good actors in the health information exchange ecosystem. So again, these are going to be CTEs that we are very much interested in your feedback. If you've got experience in any of these areas, if you could provide that information to us and how things have played out in your experience, all of that would be very helpful information for us to know about as we shape our proposals. Next slide, please. Okay, so again, I'll probably have to say this every time. We're focusing on entities that facilitate electronic health information exchange, and the RFI specifies a list of potential preconditions that we would use to judge whether an entity could continue down the pathway towards becoming an NVE. And if these preconditions are met, they would be able to go forward and seek validation through the validation processes that we would establish. Just to give folks a little bit more detail on the types of eligible entities that we anticipate, again, kind of not an exhaustive list, including but not limited to a variety of different entities that could facilitate electronic health information exchange on for a variety of different healthcare providers. Next slide, please. So if an entity makes it through the preconditions, then there would be a validation process. I alluded to this a little bit in the beginning. It could be a mix of testing and certification of products and technology that are necessary for interoperability, or accreditation of services. It's really, and this is another area where we would seek your input and expertise. The CTEs could require a different angle to ensure compliance, and we are actively interested in folks' input with respect to what's the right balance between burden and certainty in terms of an entity's compliance with the CTEs and the best approach to take with respect to to ensure their compliance and how they would meet them. Similar, as I mentioned as well about leveraging prior frameworks, regulatory processes that we've established. We envision following a very similar process for validation, which at this point we're using as a placeholder to describe this process. So if anyone has a better suggestion, I'm definitely open to that. It's coming in comments as well. Validation for us has really represented the totality of the options that we could use to confirm compliance with conditions for trusted exchange. We expect a similar process that we would pursue, just like with the, for those of you that are familiar with the permanent certification program, ONC has approved an accreditation body that then accredits certification bodies who are then subsequently authorized by ONC to perform HIT certification. We see that a similar type of process could take place. Folks are familiar with this, so it wouldn't be too new from a regulatory approach, where we'd have an accreditation body that would accredit the validation bodies, again, for lack of a better word, that would perform validation of the CTEs for the entities that seek to meet them. So at the end of the day, if an entity successfully completes the validation process, they would become a nationwide health information network validated entity, otherwise known as an NVE, as we've said here. Next slide, please. So moving into some of the kind of structure and process beyond the CTEs themselves, which are really a majority of the RFI, we're looking at ways in which we would need to mature the CTEs over time. And so we recognize that we'll probably need a process to update and retire conditions for trusted exchange as they become overtaken by the industry, as they become outdated, as statute changes. There will be a need to go through this, and we want to be able to set up an inclusive and transparent process to identify those that need to be modified and retired on a going forward basis. We have a classification that we reflect here, as well as in the next slide that I'll talk about, as in terms of the maturity cycle for CTEs. We really see them kind of falling into 3 classifications. The first being emerging, those really in the formative, kind of nascent stages. The second being pilot, those that may be used in a particular area that folks are really kicking the tires on. And then those that would be classified as national. They could be embodied in CTEs and become candidate CTEs that we could subsequently propose in a future rulemaking. But this would be as part of the overall governance mechanism, this multifaceted approach that we're trying to set up, one of the processes and structures that we would take to update and retire CTEs. Next slide, please. So kind of running in parallel with the CTEs updates and retirement process, there's also been a need expressed from the standards community to have a process to annually review or some other periodicity to review technical standards and implementation specifications to help inform a maturity pathway for standards and specifications for subsequent adoption and regulation or for subsequent use at a national scale, to provide direction on what gaps need to be filled to support nationwide electronic health information exchange. And again, similarly, so folks don't need to remember many different classifications here, we could see classifying standards and implementation specifications into emerging, pilot, and national readiness. And the interoperability CTEs would reflect the technical maturity and adoptability of the specs that had reached a national classification. So in terms of the process by which an emerging or pilot standard implementation specification, once it reaches the national classification, as we discussed in the RFI, we would consider it ready to include in an interoperability CTE for which entities would then be able to seek validation against or to. Next slide, please. We have a discussion about monitoring and oversight in the RFI and the best ways in which we could institute and establish some form of monitoring and oversight as part of the governance mechanism. We anticipate that there would be a process to receive and address complaints, as well as potentially a process to revoke an NVE status in the event that is necessary as well. And so we've included a lot of description about those areas. I do want to make the point, though, that we see monitoring and oversight really being a shared responsibility across the health information exchange community. This is not something that we think that ONC could police alone, and not something that we believe would be, the community would be best served if we alone did it as well. It really will require a strong partnership across all stakeholders in electronic health information exchange to make this happen. From the federal perspective, there's obviously ONC. There could be the accreditation body and the subsequent validation bodies. And then in other cases, there are other federal agencies, again, with respect to leveraging the authorities and regulatory processes that we have thus far. We are in an environment where there are numerous Venn diagrams of different regulatory authorities, and so we have other federal partners that could also be engaged in monitoring and oversight at a kind of more global policy level. Next slide, please. I think that wraps it up. I'm I guess I will apologize in advance for not leaving too much time for questions. I would say that there are dozens of questions in the RFI, so it's really me here to ask you to answer our questions that we have, and very much appreciate that you've attended, and look forward to your feedback. Thanks a lot.
Thank you, Stephen. This is Kate again. So we do have a few questions, and again, if you'd like to input your questions now, please please go ahead and put those in. But so, Stephen, one question is, how long is the comment period going to be for the RFI?
Excellent question, and I'm sorry I did not address that up front. It will be 30 days from the date of publication, and it should be, let's see here, it is, I did get information about it expected to be published on the 15th. And I believe, now that I've been talking, it has gone on public display. So it should be available on the Federal Register's Public Inspection website now, and we'll publish on the 15th, which is Tuesday, so 30 days from Tuesday, which will take us into June, and that's kind of process-wise.
Very good. And a couple other questions. I think on one of your early slides, I actually think in each of your slides you had sort of the S. You know, there was one, the first one had S, I think it was for safeguards. There was a question about what did the S stand for?
Yes, that's true. That's correct. So this will make a lot more sense in the text of the RFI as folks go through it. We have a table at the end of the RFI that is for easy reference. We just use the S for the S, I, and DP to abbreviate the safeguard, interoperability, and business practice CTEs.
Very good. Another one. So, Stephen, does the RFI contemplate the role of the Federal Bridge Certification Authority?
Yes, we do have some mention of that, and solicit comment on how the Federal Bridge FBCA can be leveraged. So I encourage the questioner to take a look at that and give us any insights they may have.
Very good. I think that's all. I think that covers the questions we have so far. So thank you so much, Stephen, and thanks everyone for joining us today. And we do plan to do another session like this with Stephen again, and after the RFI is, after it's been published and you all have had a chance to read and digest and may have more questions subsequent to that. So we will be scheduling another program as well. And we did just put up in the chat room also the link to the RFI. So I think given that I don't see any other questions coming in, once again, thank you so much, Stephen, and thanks everyone for joining us. And again, we'll do another session in about a week or so.
Awesome. Thanks everyone for attending today.
Have a great day. Take care.